Hi, I'm Dr. Russell Radican. I'm the Clinical Director at Wellness One Memphis. I would like to thank you for watching this presentation. It's the first of a three-part series. I truly believe that regenerative medicine is the future of medicine. Stem cell therapy and PRP have the potential to resolve so many health conditions. I'm so excited to be part of the regenerative medicine movement, to be able to bring this type of care and treatment to the Mid-South, to be able to offer hope and promise of healing and well-being for so many individuals. I'm truly grateful. Exactly who is Wellness One Memphis? We provide regenerative medicine treatment. We're an integrated functional medicine clinic dedicated to treating acute and chronic pain without surgery. We implement and utilize today's most advanced evidence-based protocols in therapy. Some of the conditions commonly treated with regenerative medicine are osteoarthritis of the lower back, of the neck, knee, shoulder, elbow, wrist, essentially any joint, ligaments, tendons, muscles. Those types of injuries respond very well to regenerative medicine. It's also being utilized for peripheral neuropathy, ALS, COPD, autoimmune disorders such as RA, lupus, diabetes, MS, Lyme's disease, fibromyalgia. It's offering tremendous promise with Parkinson's, Alzheimer's, spinal cord injuries, including paralysis, traumatic brain injuries, and even stroke-related disorders. You may be asking exactly what is regenerative medicine. Essentially, regenerative medicine is taking or delivering specific types of cells or cells products, processing them in a certain way that will help the stimulation and the healing process in a diseased or damaged area of your body. So think of it as taking cells out of your body and then processing those in a certain way and then re-injecting those cells back to the body. The body then tells those cells to heal and repair. That's essentially what it does. I do want to let you know that although regenerative medicine is truly cutting edge therapy, they're not currently covered by any form of health insurance, including Medicare. Now, I do realize this will change eventually. Thousands of patients have seen such positive results. These new therapies still are considered experimental. I do believe at some point in time, insurance will cover this type of care, but as you may be aware of, change is often very, very slow. For those individuals that have such conditions, these are your previous medical options. Essentially, this is what you're left with. Let's take, for example, if you had severe osteoarthritis of your knee. Typically, the first round of treatment would be cortisone or steroid injections. Now, this truly does give some people some temporary minor relief, but it is very minor, very temporary. It should be pointed out that the constant use of steroid or cortisone therapy can actually weaken the bone, weaken ligaments, weaken tendons, and actually erode cartilage. So it's very interesting. You have severe knee pain because your cartilage is wearing away. Utilize a therapy that makes the cartilage deterioration speed up. Doesn't make much sense to me either, but that's commonly used. Oftentimes, patients are given prescription pain medications, and we all know the problems associated with prescription pain medication. It often leads to you have an increase in your tolerance, and this become dependent upon it. And well, before you know it, you can lead to an addiction to this very powerful pain medication. Another option would be surgery, and it is a major surgery, a knee replacement, low back surgery, neck surgery, shoulder, elbow surgery. Those are major surgeries, and there's always significant complications that do occur. Another thing is long-term rehabilitation, the pain and discomfort that you go through the rehab. It's a lot. These are basically your options, or do nothing, suffer. That's not really an option for me, but a lot of people, that's what they're left with. A, B, or C, or D, suffer. Regenerative medicine treatments, the most common type of treatments include stem cells derived from bone marrow. And what that actually does, how that's performed rather, is a needle is inserted into your hip along the iliac crest, and bone marrow is actually extracted or pulled out. That bone marrow is then processed and spun through a series of centrifuge treatment methods, and then at the end result, voila, you have stem cells, and those stem cells are then injected back into the patient's painful region or diseased area to help heal and repair. The same can be done for adipose, essentially fat. That's right. I mean, a mini liposuction suction procedure is performed on your abdomen, and the fat is taken out and processed and cleaned, and the end result is stem cells. There's actually stem cells inside of our fat. Who knew? Those stem cells are then injected again back into the body. Now, both bone marrow and adipose are somewhat invasive. It requires a procedure that can be somewhat uncomfortable and painful to the patient. But the outcomes are phenomenal. So both are very good methods of stem cell treatment. Another form of regenerative medicine is platelet-rich plasma, also known as PRP. This is where we utilize the patient's own blood. We simply take a vial of blood from the patient, depending upon what we're utilizing it for, it determines the volume. We again use a centrifuge and spin it around, and this process will actually separate the protein-rich plasma, of which is very it's full of healing properties and growth factors. That is then injected into the patient's area of pain or discomfort with significant benefits. Another very promising type of treatment that's very exciting actually is the allograft stem cells utilized from amniotic tissue or from umbilical cord blood. These are derived from a healthy mother and baby from delivery, normally a C-section. So mom and baby are perfectly fine, everything's healthy and everything's good. These tissues are actually then processed and utilized for regenerative medicine because they're full of tremendous amount of healing properties, stem cells, growth factors, tremendous healing properties. So the future with the allograft stem cells is exciting because it's non-invasive. It's a procedure that could take as brief as 10 or 15 minutes, and you're in and out the office. So it's a very exciting form of treatment. Some of the most recent development of stem cell therapy is just it's overwhelming. It seems like every day something is coming out about the benefits, or a study on this type of stem cell treatment in the Netherlands, or this in Portugal, or this is going on in Spain, or Czechoslovakia. China is doing something with Alzheimer's and stroke victims. England is actually utilizing stem cells for, believe it or not, for dental repair. Instead of having a root canal or a crown or a filling, they're actually utilizing stem cells to repair the diseased tooth, because that's in fact what a cavity is, a diseased tooth. And it's very promising what they're doing. Another exciting thing about stem cell therapy is, I know it's very vain, but for things such as hair growth, believe it or not, you can stimulate hair growth, thinning hair, balding. You can actually utilize stem cell therapy and regenerative medicine to reinvigorate or stimulate the hair follicles to continue or to start growing hair again. In aesthetics, it can be used for facials and for various different things. Yes, I know those are somewhat simplistic when we're talking about diabetes or hypertension or Alzheimer's or Parkinson's, but still, just it's so fascinating the power of regenerative medicine and stem cell therapy. I saw this and I just had to comment on this. Comes from the Americans for Cures Foundation. This states that stem cells hold the promise of treatment and cures for more than 70 major diseases that affect millions of people. If you remember what I said earlier at the onset of this program, is that I believe that stem cell therapy is the future of medicine. And the fact of the matter is that the future is now, because diseases are being reversed, diseases are being halted, conditions are being literally just stopped completely with different forms of regenerative medicine. So it's very exciting, once again, to be able to offer this type of care and treatment and hope for patients with these various different types of diseases and disorders. This slide represents the changes in research and reference material. I know this is somewhat old, but in 2001, PubMed references had a little over 120 references of PRP. By the time 2013 rolled around, there was almost 600 references of PRP in PubMed. So that's over 7,000 total references in the last 10 years. That's absolutely amazing, and it's only going to increase with different forms of regenerative medicine, stem cell therapy. At this point, you probably have questions and you're probably looking for some answers. And what we'd like to do is offer you the opportunity to find out more about regenerative medicine by coming in for a complimentary consultation to our office, because we know living with acute or chronic pain is, in fact, a daily struggle, and finding relief can be very challenging and difficult, and sometimes it may seem impossible. We want to let you know that that's not the case. We're here for you. Wellness One Memphis, we can provide a diagnosis of your pain and evaluate whether or not stem cell therapy is the best treatment option for you. Essentially, you need to stop letting pain run your life. Call our office. The number's on the screen, 901-682-5335, to see if you're a candidate. So at this point, I'm asking you, what are you waiting for? You need to take the first step to pain-free living now. The fact of the matter is, you've lived with this condition long enough. There is hope. There is opportunity to find out if regenerative medicine is truly right for you. All you need to do, we've made it very easy for you. All you have to do is click on the link below, and it'll take you to a landing page where you'll fill out your information, your name, your phone number, and best time that you would like for a consultation. And someone from my office will contact you as quickly as possible to discuss with you and actually schedule that complimentary consultation. Now, I want to let you know this value is normally $475. That's right, it's $475 for this complete examination evaluation, and that's our gift to you, simply to find out if regenerative medicine is for you. So I'd like you to take this opportunity one last time. Just click the landing page, fill out the information, do something now, take that very first step. This is what you need to do. You know it, just do it, and I look forward to meeting you and helping you resolve your unwanted health condition.